Good morning to you, my viewers. Once again, yours truly, Dolphy Gilpin, coming to you from 1524 Lavista Drive, Decatur, Georgia, United States of America. And I'm continuing with the medical education that I've commenced with, and from henceforth I will choose random topics from the field of pathology, microbiology, endocrinology, hematology, epidemiology, otolaryngology, dermatology, and you name it, all the various fields of medicine. I will just choose random topics for this medical education. Ophthalmology, as they come to mind, I will just call them. Random topics will be chosen and will be addressed. Once again, yours truly, Dolphy Gilpin, coming to you from 1524 Lavista Drive, Decatur, Georgia. Well, this morning I've chosen now the topic on obstetrics and gynecology, and this is just medical education. This is not really practicing medicine at this time, just some reviewing medicine. And we're on a disorder of the body, usually affecting women, endometriosis. Endometriosis. That's my name now. And for this now, we say now that endometriosis is a disorder of the body, women, in which endometrial tissues grow outside the uterus, outside the womb, and analogously, sometimes like a cancer, it's metastases to other part of the body. So these endometrial tissues, abnormal tissue, goes outside the uterus, or the uterine cavity, and goes into other areas of the body where it should not be under normal condition, and causes complication, and sometimes very serious complication. It's almost like a cancer. Okay, so let's draw a basic diagram here for this endometrial condition. So suppose if we have now since it's a basic diagram now. Here are the ovary. Right here have the vagina. You would have the cervix. That's a basic diagram, simple diagram. You will have the fallopian tube. Touching the ovary now, here we have like a broad ligament. This would be another broad ligament. Okay, This would be like the cervix here now. No, this is the cervix down here, the vagina. This would be the ovary. Uterus. And basically we have the relevant terms here that we'll address for this endometriosis. Now what we have here now is that these endometrial implants now, usually they come about under normal condition when under the process of ovulation, when they now begins to grow outside of the uterus or the uterine lining. So you know we have some going on the ovary. We call these now endometrial implants. Which leads to endometriosis. Endometrial implants. And we write on the here, no, endometriosis. Endometrial implants here, it could go inside here as well. Endometrial implants, process of endometriosis, endometrial implants, and I write here now that leads to endometriosis. Here as well. Endometriosis. All right, so that's just a basic, simple diagram. Now the complications of this endometriosis caused by these abnormal endometrial implants going outside the uterus into they are found in various parts of the body. They could be found in the intestine, in the abdomen, colon, just about all parts of the body, under the armpit. They are known to be found in multiple parts of the body where they are not supposed to be under normal condition. And this poses a problem to the health of the woman, because this is a condition that affects women, this endometriosis. So let's see now the complications. Complication of this endometriosis. But let's give a brief statistics, about 3% to 11% of women in the reproductive age, they encounter this condition of endometriosis, 3 to 11%. And about 50% now, these are some statistics of these women that encounter this endometriosis, go through infertility problems, complication now, infertility. So that's one of the complications, infertility. This endometriosis can lead to ovarian cyst, inflammation, these inflammations and pain, the inflammation do not normally respond to non-steroidal anti-inflammatory drugs. So right now, NSAID, S-E-I-D, non-steroidal anti-inflammatory drugs. Normally, these the endometriosis does not respond, the complication it causes, does not respond to non-steroidal anti-inflammatory drugs. And so special pharmacochemical has to be developed to treat this abnormal condition. Because then you have pain, cramps, amenorrhea, dysmenorrhea. That's right, it's no amenorrhea. Dysmenorrhea. Well, amenorrhea is for girls up to 16 age when they don't have the period. And dysmenorrhea is a painful menstrual cramp. Every bleeding, and this every bleeding can be intermittently. You have to be changing your pads every 2 hours. That's a sign of this endometriosis. Because under normal conditions, a woman with a normal period shouldn't be having such heavy bleeding. And then you'll probably have to administer some progesterone or norhisterone, and some of those other pharmacochemicals. Inflammation, ovarian cysts, infertility, adenocarcinoma, that's a cancer now, adeno. Ovarian cancer. You have ovarian cyst and ovarian cancer. Inflammation, scar tissue. Intestinal bleeding and bladder complications. And bladder complications. And other medical complications. Now, briefly, one of the method of diagnosis of this thing, and let's say, the diagnosis usually takes sometime over 10 years to make this diagnosis of endometriosis. Because what happens, you'll see the female visiting the medical office or the doctor's office and having symptoms of pain, headache, and menstrual cramp, and all that. And sometimes it's the symptom is latent or hidden, or what we call symptomless, and so sometimes this abnormality or malignancy is not detected until over 10 years before they make, a precision that this condition is endometriosis. So briefly, we say that laparoscopy and ultrasound this process, diagnostic process, can help to detect and diagnose the condition of endometriosis. So, all right, so that's just a brief description of endometriosis, and we have covered what it is, and later on we'll look more in depth into the causes, and we have stated briefly how to diagnose it, and that the diagnosis sometimes takes up to 10 years before they could for sure to say that this abnormality is endometriosis. Briefly, a UCLA Edu perspective on it, that is the University of California, Los Angeles, .edu, is that endometriosis tissue, in endometriosis, the tissue that makes up the uterine lining, or the lining of the womb, is present in other parts of the body. That is these endometrial implants, or the tissue that make up the uterine lining, or the lining of the womb. These tissues are found in other parts of the body. Now, endometriosis is usually found in the lower abdomen, the pelvis, but can be found in various parts of the body. Women with endometriosis now have symptoms of abdominal pain, periods, heavy bleeding, pain, painful sexual intercourse, and that this endometriosis may also be asymptomatic, that is, without symptoms. So that's a brief now description of endometriosis, and we will return with some other perspective and treatment and causes and diagnosis. So let's take a break here from endometriosis, and we'll return.